On this Thursday night, grim projections for Canada's biggest province. The looming crisis as deaths and hospitalizations continue to rise.
We're bending the curve a bit, but we have to do better than that.
Plus, the pressure from the premiers on the Prime Minister, the demands for more money for health care. The two Michaels spend 2 excruciating years locked up in China. Are they any closer to freedom? The hot business of dry ice. A Canadian company's vital role in distributing the vaccine. Plus, they died within an hour of each other.
There's not a moment I've seen them not going together.
How COVID ended a lifelong love story.
Global National with Donna Friesen.
Good evening and thanks for joining us. The good news about a vaccine on the way is being tempered by the reality of what is still happening in many parts of this country. Ontario, Canada's biggest province, has set a new record for new COVID-19 cases in a single day, nearly 2,000, and 35 more Ontarians have died. Quebec reported more than 1,800 new cases today and 33 more deaths. In Alberta, more than 1,500 new cases were reported. 13 more Albertans died. BC has more than 720 new cases and 28 people died in the past day. That's a record for BC. Going into the holiday season and the new year, the picture is nothing to celebrate. In Ontario, the percentage of positive tests appears to be flattening, but projections released today contain lots of bad news. In Toronto, 70% of cases have no epidemiological link, meaning it's not known how people got infected. And the projections show hospitalizations, including ICUs and deaths, will all keep rising. The Ontario government has extended all COVID-19 emergency orders until at least January 20th. Eric Sorensen has our top story tonight.
COVID-19 has swept into this London, Ontario hospital. More than 140 positive cases, half among patients, half among staff. In Mississauga and Toronto, smaller outbreaks across a network of 3 hospitals where at least 36 staff and several patients have tested positive. And while outbreaks are a problem in some hospitals, many face another challenge: space. A hospital network in York Region has declared it's at a tipping point in managing COVID-19 volumes. Across the province, 1 month ago, the number of COVID patients in hospitals and intensive care units was manageable. Since then, hospitalizations have almost doubled, and the number in ICU beds has almost tripled in 1 month. What now?
You could see a rapid movement amongst hospitals to have to start making more beds. And what that means is basically starting to cancel elective surgeries.
The basic problem remains: rising COVID-19 cases. They hit 1,350 per day on average last month. Worst case projections warned of 6,500 cases by now. A partial circuit breaker, new restrictions in hot zones, has helped flatten the curves somewhat, but numbers have still climbed to more than 1,860 cases a day on average, 500 more than a month ago.
We're bending the curve a bit. As the data shows, we are slowing the rate of increase, but we have to do better than that.
That's because rising cases will lead to still more hospitalizations. The number of ICU beds in use over the last month not only topped 200, it will stay above that threshold till January at least. And the projection for even small percentage increases could see demand for ICU beds approach 300, or worst case, 500 ICU beds.
You can see how the system requires a bit of breathing room in ICU beds in case of emergencies. And what COVID patients are doing is they're eating into that breathing room to the point where already there's almost none left.
One hopeful development: starting next Tuesday, Ontario will begin administering vaccine doses in Toronto and Ottawa. But initially it will amount to a trickle of protection as COVID-19 cases and hospitalizations continue to rise. Eric Sorensen, Global News, Toronto.
The 2 vaccination sites in Ontario will be the Ottawa Hospital and the University Health Network in Toronto. Starting on Tuesday, December 15th, the first doses of the Pfizer-BioNTech vaccine will be given to healthcare workers in long-term care homes and other high-risk places. It is no surprise that vaccines and healthcare dominated discussions today between the Prime Minister and the Premiers. Much of it comes down to money, and there's never enough. Our chief political correspondent, David Akin, has his ear on these talks. David.
Yeah, really, Donna. Just 2 topics in front of the First Ministers today. They spent the morning going over details of the vaccine rollout plan. And then after lunch, the discussion got a little more pointed. And that is how one participant described it, as the premiers tried unsuccessfully to get Prime Minister Justin Trudeau to commit to giving the provinces a combined $28 billion extra next year for health care.
Unfortunately, despite the Premier's unanimous demand, Justin Trudeau refused to commit to substantially increase health transfer. He said that it was premature because of the COVID-19 situation to have this discussion. We think that it's more important than ever.
Now, we heard the same kind of statement from Saskatchewan's Scott Moe, Ontario's Doug Ford, but Prime Minister Justin Trudeau said he is ready to put more money into Canada's healthcare system, but he would not commit to the Premier's demand. So it looks like those pointed discussions are going to continue. Donna?
David, Quebec has said it wants the first Pfizer-BioNTech vaccines to go to residents in long-term care homes. Other provinces say that's not feasible because that vaccine is so tricky to keep frozen and move around. What more have we learned about that?
Yeah, this is really interesting, and it is something all the provinces are grappling with because all the provinces have put vaccinating residents of long-term care homes right at the top of their vaccination priority list. But the problem is, those residents really cannot be moved, and Pfizer-BioNTech does not recommend sending vaccination teams into homes, exactly for the reasons you said. Their vaccine requires extra cold storage, very special handling instructions, and so provinces right now are trying to figure out how to do this with the Pfizer-BioNTech vaccine.
We expect that it will be able to be broken down and transported in limited ways, perhaps in the next couple of weeks.
Now, the backup plan is waiting for that Moderna vaccine. Wait until that's approved, because that's the vaccine that is easier to work with, and vaccination teams could take that into long-term care homes. Now, on that front, premiers were told to expect their first shipments of that Moderna vaccine early in the new year. And that's important because it is the Moderna vaccine that is going to be the one that goes to the 3 northern territories and to remote Indigenous communities. Donna?
Okay, important information. David, Akin in Ottawa, thanks. The U.S. is poised to be the next country to approve the Pfizer-BioNTech vaccine. An independent advisory panel of experts spent the day reviewing data, and late today it recommended to the FDA that the vaccine is safe and effective. That means vaccinations in the U.S. could begin almost immediately. The country is in crisis. More than 3,000 Americans died of COVID on Wednesday, a new record for a single day, and more than 106,000 people are in the hospital. Jennifer Johnson on America's final phase on the path to a vaccine.
As over 125 Americans die of COVID-19 an hour.
The information submitted with the request includes safety and efficacy data.
An advisory panel to the Food and Drug Administration recommended emergency use authorization for the experimental Pfizer-BioNTech vaccine. The FDA commissioner says he has full confidence in the group's decision.
Our scientists are world class. They're mothers, fathers, brothers, sisters, grandparents. We've also been there with the American people, and we understand the urgency.
The panel was most concerned about allergic responses to the vaccine after at least 2 people with a history of severe allergies had serious reactions in the UK. As a precaution, officials there are recommending people with severe allergies not be inoculated.
Shortly after getting the vaccine, they developed a severe reaction, and they fortunately were able to give themselves the EpiPen and got better. You know, that type of reaction tends to be very rare.
FDA approval of the vaccine is expected Friday. The rollout will be immediate. UPS and FedEx trucks will leave Pfizer's deep freeze center in the Midwest, and along with specially outfitted planes, deliver millions of doses to every part of the country.
We are still operating at historically remarkable speeds. I think we do have huge challenges ahead here in the United States in distributing the vaccine.
Vaccinations could begin this weekend. The Trump administration's Operation Warp Speed plans to have 20 million Americans vaccinated by the end of December. Healthcare workers and nursing home residents will be first.
Personally, I cannot roll up my sleeve fast enough to get this vaccination, and I guess I would urge the community when it's that time to do the same.
In the early part of 2021, federal health officials believe their biggest challenge will be convincing most Americans the vaccine is safe and getting them to show up for both doses of the Pfizer-BioNTech vaccine. Jennifer Johnson, Global News, Washington.
The Moderna vaccine we mentioned, also in the pipeline for approval in Canada, is now in clinical trials involving children and adolescents. The trial in the U.S. plans to enroll 3,000 healthy people between the ages of 12 and 17. Each participant would receive either a placebo or the vaccine in 2 doses, 28 days apart. Moderna hopes to have enough data on the safety and efficacy of the vaccine to allow it to be given to 12 to 17-year-olds before they head back to school in the fall of 2021. Pfizer-BioNTech began vaccine trials on children in October, and Canada has pre-ordered tens of millions of doses of both vaccines from Moderna and Pfizer-BioNTech. All elementary and secondary schools in Windsor, Ontario, and surrounding Essex County will close on Monday because of a rapid rise in COVID-19 cases there. Students will go to online learning, and schools will remain open to teachers and staff. Full-time daycares operating within schools will also be allowed to open. The order will be in place until December 18th, when students go on break, but it could be extended beyond the Christmas break. Today, the region reported more than 100 new cases for the second day in a row. A team of specialized paramedics is helping deal with a surge in COVID-19 cases in a community in northern British Columbia. Yesterday, a rapid response team arrived in Fort St. James. It's a small rural community about 11 hours north of Vancouver. The team is expected to stay there for several days. It's the first time this highly trained paramedic team has been deployed. There are at least 40 active cases of COVID-19 in the region. 2 Canadians have endured the entire pandemic imprisoned in China, accused without any evidence of espionage, and today marks a grim anniversary for them. Michael Kovrig and Michael Spavor have been held for 2 years now, kept in separate prisons, largely cut off from the world. For months, they weren't even allowed visits from Canadian consular officials. There was some confusion today when a Chinese Foreign Ministry spokesman said they'd been indicted and tried. The Canadian government said that official misspoke. There has been no trial, and there appears to be no progress in efforts to bring them home. Mike LeCouture reports.
For 2 men who have been through so much, Michael Kovrig and Michael Spavor are said to be in good shape and good spirits, according to Canada's ambassador to China. Dominic Barton has had virtual visits with the 2 men in their respective jails, speaking to them via video conference. Kovrig's wife, Vina Najibullah, says Michael is keeping up a strict exercise regimen and reading philosophical books to keep his mind strong.
Oh yeah, I've sent a few shipments of books.
Spravor's friend John Dunbar has also been sending a steady supply of reading material. He's known Spavor since 2006 as a gregarious guy caught up in a diplomatic dispute.
I have faith that if anybody can survive this and come out of it still able to smile, it'll be him.
Spavor and Kovrig's detention is widely seen as retaliation for the arrest of Huawei CFO Meng Wanzhou on a U.S. extradition request. But after 2 years, there's been little movement.
The release of these 2 brave Canadians is an absolute priority for our government.
Canada has long called the 2 Michaels' arrests arbitrary. The government has recently taken a stronger stance, calling it coercive diplomacy. But that's still not enough for the opposition leader.
We have to show that we're willing to stand up for our interests, our citizens, and our values, sometimes with tough and difficult decisions, like sanctions.
Now, Canada's approach has been to rally international partners to pressure China. And this former diplomat says Canada needs to do more.
Hoping that if we treat the Chinese regime with extreme tolerance, that they will see their way clear to doing the right thing, and releasing Kovrig in favor has not worked.
Now, the U.S. could help if Meng agrees to a deferred prosecution agreement. Talks between her lawyers and the U.S. Justice Department are reportedly underway, and some believe that could open the door to China releasing Spavor and Kovrig. Donna?
Mike LeCouture in Ottawa, thanks. New charges in the Beirut blast coming up, the accusations against Lebanon's Prime Minister. More charges have been laid in connection with that deadly explosion at the port in Beirut. Lebanon's caretaker Prime Minister Hassan Diab and 3 former cabinet ministers are now facing negligence charges. They're the most senior people to be indicted. More than 200 people in Beirut were killed. Thousands more were injured in the explosion in August. It was caused by the ignition of a large stockpile of explosive material that had been unsafely stored at the port for years. There's more grim news about those millions of culled mink in Denmark. They may be contaminating the groundwater. 17 million mink were culled in early November after a cluster of COVID-19 mutations were identified in the animals and in workers. Now there's a risk that groundwater below the 2-meter pits will seep into nearby streams, lakes, and reservoirs. Geophysical probes are being done to assess the environmental impact. Keeping it cool still ahead. The BC company that's helping the vaccine stay on ice.
You're watching Global National.
A relatively new Canadian company is preparing for its biggest, likely most important contract ever. It's been hired by the government to provide dry ice to transport the Pfizer-BioNTech coronavirus vaccine. Because as Paul Johnson explains, dry ice is now a hot commodity.
So this is one of our dry ice bins that we use at Fraser Valley Dry Ice here.
Meet one of Canada's newly crowned kings of the cold.
We saw an opportunity that we could manufacture dry ice on demand for our customers at a competitive price.
Paul Thompson and his business partner started the Fraser Valley Dry Ice Company early this year with the intention of supplying the food packing business. An astute move given the big farming economy near their Abbotsford, BC facility. Then the world changed. While the arrival of an effective vaccine in a matter of months has been an historic achievement, there's still a major challenge: distribution. Complicated by the Pfizer-BioNTech vaccine's need to be stored at minus 70 degrees Celsius. Luckily for Western Canadians, this new dry ice factory had just come online.
This machine is pretty high tech. Most of the productions that we do with it are basically as easy as a touch of a button.
Dry ice is made entirely out of the gas carbon dioxide. It's one of the most plentiful compounds on planet Earth, and it's turned into a solid through the process known as deposition. Very useful for keeping frozen foods cool, shipping our new vaccine, or making awesome fog for a heavy metal ship. Churning out the pellet-sized pieces that are ideal for storing and shipping the new vaccine. Thompson is confident their machine can meet all the needs of their new contract with the federal government. They're ready to ship at a moment's notice, if still a bit surprised by the speed that this new business model appeared.
We feel very excited. We're very happy that we get to be a part of the solution.
Paul Johnson, Global News, Abbotsford, BC.
A husband and wife lost to COVID-19 within hours. Next, one BC family's tragedy. More than 13,000 Canadians have died this year of COVID-19, and beneath that big number are so many individual stories of lives lived and families left to grieve. Tonight, we have one of those stories, a husband and wife in BC who spent their lives together and who died within hours of each other. Sarah McDonald reports.
You can see how beautiful my mom was.
In their nearly 70 years of marriage, Hasnali and Shel Sultan Remtula were inseparable.
There's not a moment I've seen them not going together. It was a true love, like a true soulmate's true love.
So to their adult children, it was devastating but not exactly surprising. The pair died within hours of each other on Sunday, both in separate hospitals, both having somehow contracted COVID-19.
I could not bear it. I was totally blank, like I don't know what to do.
First, Al Karim Remtula's mother passed.
Her heart failed. It was like heartbreaking. It also felt like she actually was with me, telling that I'm also going to take your dad with me.
and then his father less than 2 hours later. Having never learned his wife was gone, but his children think he somehow knew.
I started saying my prayers, and within 10 minutes, he passed away.
Their deaths marking a sad and sudden ending to a remarkable love story spanning 7 decades and 2 continents. The Remtulas still well known and highly respected in Zanzibar and Tanzania for dedicating their lives to public and community service, a legacy that continued in Canada.
He was more interested that the family should be here. He was always telling me that if you want to see heaven, that's heaven.
With both his parents abruptly gone, their eldest son now feels it's his duty to share their story, and a warning that bears repeating.
Please, please, protect yourself, protect your elders are the most precious thing.
His may no longer be here, but his wish is in death his parents might save lives. His message? Wear a mask and do everything in your power to protect the most vulnerable among us.
I'm going through a hard time, but in the same time, I feel like I'm so blessed that I was there with them till to the last breath. And I'm so blessed to have parents like that. We had the best mom and dad.
Sarah McDonald, Global News, Vancouver.
And that is Global National for this Thursday. I'm Donna Friesen. Tonight is the start of Hanukkah, the Jewish festival of lights, and people are finding creative ways to celebrate this year. A synagogue in Ottawa is having a drive-in Hanukkah light show. The message of this celebration is that a little light dispels a lot of darkness. Certainly a message we can all use this year. Happy Hanukkah to all of you who are celebrating, and thanks for watching. Robin Gill will be here tomorrow, and I'll see you on Saturday for the new reality. Take care of yourselves. Bye-bye.